Hello, everybody, and good morning. Welcome to Discover Your Possible 2020. My name is Cosi Belloso. I'm a physical therapist here in Tampa, Florida. I've been a PT now for a little over 17 years, and I've pretty much worked in every setting imaginable, from ICU, inpatient rehab, home health, and outpatient. We're going to be talking a little bit about some of those experiences. And I've worked with so many different individuals with so many different pathologies, but my passion is working with the amputee and limb loss community. I have a private practice here in Tampa called Palanca PT, and it is exclusively for working with people recovering from limb loss, teaching them how to get ready to use their prosthesis, walk, run, and get back to their lives. So I am also the host of Cosi Talks, if you can see the sign up here. Cosi Talks is a live show I do every Wednesday night on Facebook, where I answer all questions regarding recovery from limb loss. And I love bringing on special guests, experts in the field, and bringing different educational topics. I want to say a special thank you to Mission Gate team. This has been an amazing accomplishment that they were able to bring this virtually, and in doing so, be able to expand on a global level. I just saw the list here this morning of all the different countries we have joining us. Obviously, we've got the United States. We have Portugal, tudo bem, tudo bom. We've got Nigeria, India, Pakistan, the Philippines, ¿cómo está? We have Canada and Ecuador, buenos días, Ecuador. So I am so excited to be able, as a clinician, to speak to so many different people in so many different countries and different cultures. So guys, if you've watched my show, you know that I love to interact with my audience. So please don't be shy. We do have a little bit of a delay here in terms of the comments, but I'm going to be monitoring these comments, and they're already starting to roll in. We've got Robin. Robin, you are amazing. Thank you so much for bringing me on board with this team, this amazing team. We've got Carol here. Summer, good morning, Summer. We've got Pete Rossi. Good evening. Oh, from India. Oh my goodness. Thank you for joining us this evening. Guys, it's such an honor to be able to speak in front of this audience. I won't lie, when we first got together this year to talk about how this was going to look like, I was disappointed. I was actually disappointed because last year we did so many interactive labs. We talked about the gait cycle. We talked about muscle strengthening and physiology. We talked about proprioception, and then we did all these great exercises with it. So this year I had big plans to bring in a follow-up to all of that. But obviously, COVID had different plans for all of us. Now, the silver lining with this is not only were we able, like I said, to expand to a more global audience for this conference, but I'm going to talk to you about something today that's not quite so tangible, but it's still extremely important in the recovery process from limb loss, and honestly, from any trauma imaginable. As some of you may know, on a personal note, I am a mother of 4 beautiful children. I'm a violinist, I'm an athlete, and I'm also a breast cancer survivor. And the reason why I mention this is because even though I cannot relate to many of you in terms of losing an arm or a leg, I do know what it's like to have my life turned upside down from one minute to the next with a health crisis, and to have to undergo a very long recovery process, and then the process afterwards of putting my life back together again and seeing what that looks like. So today's talk is going to focus a little bit more on the mindset of healing from something like limb loss. It's about how do you take it to the next level? How do you address fear? Okay, so here I'm going to click back to some of these sections. I don't want to miss any of these comments, guys, so I'll be clicking back and forth. We've got Tina here, Phyllis. Oh, my wonderful. We've got Mary here. Comments are flying everywhere. This is wonderful. We've got, Carol, thank you so much. We've got Diana Baker. She says, thanks. Good morning, everyone, to bring us together, sharing their story. We've got some folks here from Germany tuning in. Excellent. All right, guys. So as I mentioned earlier, in my years of practice, I've had the good fortune of working with people from ICU, acute care stay, inpatient rehab, home health, and now with my clinic in the outpatient setting. And when I think about all the conversations that I've had with all of my patients over the years in these different stages, there's definitely a common theme that I would have to address with each of these patients in each of these stages. And it was about fear. But ironically enough, it wasn't about fear of failure. It was about fear of success. It was addressing about the fear and the anxiety that's associated with going to the next level of recovery, of realizing that they were ready for that next level and that they were going to embark on a new phase that was unfamiliar and honestly quite scary. So I'm going to talk a little bit about what that looks like in the different phases of recovery, and hopefully we'll have some light bulbs kind of going off. And guys, let me know what you think. If there's anything in this conversation that you feel like, yep, this is definitely something that I can relate to, that I went through, post it up there in the comments section, not just so I can read it, but also so that our fellow viewers can see that they're not alone in some of this process. So I want to take you guys back to your original amputation surgery. For those of you who had multiple revisions, I want you to kind of think back to the most recent one, hopefully your last surgery. Think about those first moments when you regained consciousness, and you probably had some sort of thought like, oh, good, I made it through the surgery. I know I did when I had some of my cancer surgeries. It was the, oh, goody, I made it to the other side. I'm alive. Now what? Okay. For many of you, what came afterwards was probably a few days, quite a few days of painful movement, of learning how to do some of the simplest of tasks again, learning how to sit up in bed, learning how to move the limbs over to the side, learning how to stand and transfer to a bedside chair with a walker. Any of this sound familiar to many of you? Good morning, Connie. Good morning, Destiny. Guys, I like talking to my audience, so you'll see me interrupting myself to go talk to my audience every once in a while. Now, guys, I know when I would work with my patients during this stage, I would always reinforce with them the breakdown of these tasks. So instead of coming in the room with my walker and telling my patient, okay, let's get you up out of the bed and get you into the chair, I would break it down into bite-sized pieces. I would say, put the head of the bed up. Good, you didn't pass out. Now let's start helping you move that limb to the side of the bed very carefully. Now let's have you scoot towards the edge of the bed. And that was a really scary moment. I would slowly and carefully move them through these little stages until they were safely in the bedside chair. And there were many reasons for this. Number one, I didn't want my patients to end up on the floor on their first day of physical therapy. That's really not a great way to start out. And two, I wanted them to see that when they had focused on the immediate task at hand and blocked out everything else in their minds, they could make what seemed like an impossible task be able to break it down and make it happen. Now, once my patients were in their bedside chairs and more or less settled there, I would purposely ask them, bet you didn't think you were going to be doing all of this today. And it wasn't just to make conversation, guys. It was to get my patients to reflect upon what they had just accomplished. This obstacle that had seemed so scary to them when I told them about it coming into the room was now something that they could check off their list. And if I had the opportunity to work with the same patient through their discharge, I would always try to build upon what I had planted in them on that first day. In a way, I wanted to give them a little bit of my own clinical mindset, the ability to acknowledge that the task in front of them was possibly going to be a doozy, but also to take that task, break it down to its components, and do it piece by piece, step by step. And I wanted them to realize that with the help of a highly qualified rehab team, they could be in charge of their mindset and learn how to tackle and get to those goals. So herein lies the rub, as my husband would say. The real test would come the day of the discharge. The hospitals I used to work at would require for amputee patients to be cleared by the physical therapist before they could go home or before they transferred into inpatient rehab. And this was a responsibility I took very seriously. I knew that my patients had to be absolutely solid and safe with their basic mobility if I was clearing them and sending them home to an environment that would have stairs and steps and children and throw rugs and pets. And I also had to make sure that they had the right amount of strength and endurance behind them to be able to tolerate the 3 hours of therapy that they would be receiving if they were going to inpatient rehab. So you can imagine how surprised I was, and this was back in my early years as a physical therapist, when I would walk into a patient room and I would say, congratulations, you're ready to move on to the next step, you're going home, or you got accepted into the inpatient rehab program, and I would get the complete deer in the headlights look. And here's some of the responses that I would get from my patients. I would get, I'm not ready. I'm not strong enough yet. 3 hours a day of therapy is way too much. My home doesn't have all the modifications for it. What am I going to do with my medications? Now, guys, it's not to say that these concerns weren't valid. These were very real worries. But as I would explain to them, all the reasons that they were kind of giving me had already been addressed. I would say things like, yes, Mrs. Smith, you're ready for rehab. Do you remember how you walked the whole distance of the hallway with the walker? Or, Mr. Smith, don't worry, your home modifications aren't done, but your family's already gotten the downstairs part of your house ready for you while you're waiting for those mods to be completed. Or, Mrs. Smith, don't worry, we've arranged for the home health nurse to meet you at home when you get there to help you get settled in. Now, as I gained more experience, I realized it wasn't necessarily the details that were dragging my patients down. It was the fear of the unknown, of having to manage a new setting with new obstacles. And it was a scary situation that they hadn't encountered yet with their new body. Does anything ring bells here for you? We're going to take a quick poll here. What was the scariest part for you when it came to finally going home for the first time after your amputation? And I'm going to switch over to the comments section because I've seen some comments flying in and I don't want to miss too many of these. Let's see, we've got Melanie saying, oh, thank you so much, Melanie. We've got Destiny and we've got Jennifer saying different, oh, thank you. Love that you're discussing these different recovery phases and goals. Yes. And guys, this is something that as clinicians, we have to learn as we go with the experience. And I know that the way I approach my patients now as an experienced therapist is so much more different than when I first started out as a PT. And I'm recognizing that teaching my patients how to have this mindset is just as important for them for their outcomes as it is to teach about gait, about balance, range of motion, and strength. So Tina says that losing the nurse and ancillary support and being a burden on my social circle was very scary. Pete says, haven't gotten home yet, checked myself into assisted living. Destiny says she was wondering how I would be a mom to my 1-year-old. Destiny, that's something that hits home for me as well. Marcelo is from Brazil. Oi, tudo bem, Marcelo? We've got Phyllis saying, getting home into my home was a major fear, right? Trying to get in through those steps. Maggie says, having to go straight into isolation, knowing that I had to cope alone at home with the right BK revision 2 weeks ago. My goodness, and this guy's, everything I'm saying now, it's not even within the context of what's going on with COVID. Linda says, getting into the car and getting out when I arrived home. Linda, I gotta tell you something, when it comes to teaching all the different aspects of mobility for my patients, teaching patients how to get into and out of a car is still something that will get my own heart rate going. And I've done it hundreds of times. Tina says, having to plan for caring for my own primal needs, food, bathroom, etc. Yep. Haravansh from, we got our listener from India says, it took 2 weeks for me to look normal and answer some questions of my friends and family. Carol says, being in the Army, I learned that where there is a will, there is a way. Even if it meant crawling on all fours, I would get from point A to point B. Hua, Carol. Thank you for your service as well. Jody says, fear equals free each avenue to recovery. I like that, Jody. So guys, let's talk a little bit more. I'm going to switch back to my screens here. I'm so proud I haven't accidentally clicked myself out of this talk on accident. Okay, guys, so that's kind of like the first stage, those first initial stages, which some of you right now are currently going through it. So let's move on to what it looks like afterwards. Later in my career, I worked for several years in the home health setting here in Tampa, in the Tampa area. And while the obstacles and issues were different compared to those I would encounter in the hospital itself, that fear factor was still very much there. And again, my approach was very similar. So for example, when I would first go to a person's home after they're discharged from the hospital, I would address the bathroom issue first. And I think there was somebody here who said primal needs, right? How to get food, how to get to the bathroom, okay? And when I would ask my patients if they had been to the bathroom by themselves yet since they had been home, again, deer in the headlights look, right? A task that once upon a time had been done without thinking now required a full-on game plan to perform. And once again, guys, it came down to teaching my patients how to take one problem at a time, focus on that task in front of them. We could deal with the cranky kids and the family later on, and how to break it down. So in this case, I would literally clear the path for them. I would take out throw rugs, toys, shoes, anything that could possibly be a trip hazard. They would call me the feng shui PT. And inside the bathroom itself, I would take out the little bath rugs, the waste paper basket, anything that could be a trip hazard. I'd have all the doors wide open and ready. And guys, my patients seeing me scuttle around and take these steps, I could see them kind of start to formulate a plan in their own heads as to how they would get into the bathroom. I could see them start to break it down in their minds, and they would realize that they could, in fact, accomplish this feat. Now, it's not to say it would always go smoothly or even well, but always at the end, I would once again have my patients reflect upon what they had been able to do, and to understand that the next time they attempted this activity, they were going to be able to do it with just that much more knowledge, with a more peaceful mindset, and knowing that what they would have to adjust and improve upon, and that with practice, they would continue to improve everything that they try. So guys, some of you mentioned here what were some of your obstacles when you first went home, but if you have anything else you want to add to that, please do that right now. So I know Destiny mentioned about how to maneuver with being a mom to a 1-year-old. Jody says she would take the doors off, and getting off the toilet is scary. It is. And as a home health therapist, a lot of it was just problem solving and getting people to be comfortable within their own homes and making that a safe environment that they could feel comfortable moving in. So let's see, let me click back to the other screen. Sorry guys, I'm like clicking back and forth here. So once my patients could get to the bathroom safely, check. They could do basic activities at their kitchen sink, check. They could get to and from the bathroom and bedroom and watch TV, maybe even get to the mailbox for some fresh air. Things were beginning to progress with their strength and range of motion. The wound was starting to look better. The residual limb was starting to feel better. And then comes the next big step that I would throw at my patients, going to church. Now, the reason I use church as an example is because here in Florida, I don't know about other states, in order to be declared homebound and to receive home health services, the only places you're allowed to go to are your doctor's appointments and to church. So if my patient was someone who had previously attended church, I would really try to get them back there. Not to mention, if you're Catholic like me, all that standing up and kneeling down does amazing things for your glute muscles and strength there. But anyways, once again, the fear of the unknown, guys, it was the fear of taking it to that next level, the fear of exploring outside the safety of their home that would paralyze my patients. All they could see was the enormity of how to get to the church pew, that final goal. And once again, it was about getting them to focus on one thing, that one task in front of them, and build from there. So in this example, guys, I would start with teaching them and their caregivers how to get themselves into and out of a car safely in their own driveway. And I believe there was somebody who made that comment that getting into and out of a car was a very scary thing. And it's a very scary thing. But fortunately, it was something that we could practice right there in their home environment as often as we needed to until they felt comfortable. And then I would often have the caregiver or a family member go and take a look at the parking situation at the church. What did the handicap parking spot look like? Where was it located in relation to the nearest entrance to the church? Were there any benches along the way where people could sit down and take a break while they were getting into the church? Could maybe one of the ushers put a chair at the entrance with armrests so that they could minimize the amount of distance that they would have to be walking? Guys, I would literally plan a route step by step with my patient and their caregiver. And I would even suggest that they arrive 15 minutes early to avoid the rush into and out of the building. The nice thing is with church, once they got there, all they had to do was just kind of sit down and rest. But what a sense of accomplishment, guys, when my patients would take that big leap of faith, bad pun, sorry guys, and actually get themselves to that location. So quick poll, another one of my quick, crazy, Cosi polls. What was the first place that you all went to that was like your first big outing outside of your house and into your community? What was that place and how did you tackle this? I'm gonna go see what these comments are. Let's see, right now I can imagine going home, says Pete. Robin she had obstacles of 2 big Labrador retrievers with wagging tails. Let me tell you, those wagging tails can pack a punch when you're trying to walk around your home. Summer says, church is the best place to go to give all your problems and fears to the man upstairs. Amen to that. We've got Bruce saying, how long would you say it takes to go post-op to going to church? Bruce, a lot of that was just also dependent upon the surgeon. If the surgeon I would always check with my patient surgeons first and just say, okay, are they clear from a medical standpoint to be out in the community? Do they have any issues? Obviously now with COVID, things look very differently. But prior to COVID, do they have any issues with their immune system that would prevent them from going out? And then once they were cleared from the medical standpoint, Bruce, what I would do is it's a mobility. I would make sure and I would drill my patients to make sure that they were safe getting into and out of the car, practice walking the distance, working a lot with the family and the caregiver to make sure that they were safe. All right, Keith says the mall, that was the big area. Carol says the big VA hospital. Let's see, the other Carol says going to my daughter's home and going up her stairs. Haravansh says my college with my friends in a car. I waved some people after 1 month of being bedridden. Jean says, no one helped, boy, these comments are wonderful. No one helped me go to the bathroom. I was taught to stand up using the rail of my hospital bed and someone taking away my wheelchair, putting a commode behind me to take care of business. Linda said, going to the restaurant, had family and friends with me. Susan went to work and cried, completely overwhelming seeing everyone. Isn't it amazing? And then Robin said she left the hospital and went immediately to her son's football practice. Maggie says the laundry room downstairs is my apartment block. Opening my front door to go to the lift had me crying with fear, but I did it anyways. And guys, these comments are going so quickly. I hope all of you are able to see this. It's amazing how just even the smallest of tasks can be such an accomplishment, guys. For me personally, after I had 4 major surgeries related to my cancer, and after the first one, it was getting to go see my daughters at their spelling bee. And this was maybe 10 days after my first major surgery. They were in the school-wide spelling bee, and I knew that all I had to do was get from the parking lot to the chair that somebody had set out for me in my kids' school gym to hear them in their spelling bee. And that was, that was huge for me, huge. I went from running 5 miles a day to just being able to get from point A to point B and sit down in a chair and listen to my kids participate in their spelling bee. And I felt like I had accomplished the world with that. All right, guys, let's move on because I think at some point someone's gonna have a hook and pull me off the screen because I'm running out of time. No. So let's go on to that final phase, and it's outpatient. It's currently the phase that I am in right now. And to me, I kind of consider it to be the final frontier. You can tell I'm a Star Trek fan, right? It's the phase where many of you will be finishing your traditional rehab. And after that, it's the great big scary world that you are released into. Now, in my current practice setting, I have one patient right now that I feel like she's kind of my poster child right now for trying to establish this mindset that I want to give you today. I've been working with her for some time, and we've made a lot of improvements on her strength and her balance. She finally got in with the right prosthetist and has a beautifully fitting socket. All the pieces from a physical standpoint have been coming together. And she is ready now to go out into the community without a cane. And for those of you who know me, you know I am a real stickler about making sure that my patients are more than adequately prepared to do something like this. I want to make sure that they are absolutely safe before I turn them loose in the community without a walker or a cane. But right now, what I'm working with this particular patient, it's not just about the progress with her strength and balance. It's with fear of letting that cane go. It's with getting this extremely active individual to go to the grocery store by herself, to take that trip to the mall with her granddaughter, to go on a plane and visit her family out of town once things with COVID calm down, hopefully calm down a little bit. And I won't lie, this is a struggle for me as a clinician as well, because I know that I can only take her so far. I've already given her all the tools that she needs to physically be able to do this safely. Now she needs to take that next big, giant leap. I can only lead her to it. She has to be the one to rip off that Band-Aid and take that next step. So guys, for those of you who have been able to receive physical therapy in an outpatient setting, what are some of the activities that your physical therapist is pushing you to do? Because I know I'm not the only one. And if I have any clinicians listening in right now, I want to hear from you as well. What are some of the higher end activities that you try to get your patients to do to push them out of their comfort zone? I know I'm missing some of the comments here. Let's see what's going on. Tina says her first minor outing was walking in the neighborhood with her home PT and then with family and friends using a knee scooter and then crutches. First major outing, a 5K on side sticks crutches, and had a big group of friends to join and follow with a wheelchair. That is awesome, Tina. Fionn says, thank you so much. It's really insightful to what it's be like in the clinical mindset when treating and helping amputee patients. Absolutely. And Fionn, even as a clinician, if we can give our patients a little piece of this clinical mindset to help them kind of step back sometimes and try to give them those same objective lenses that we have, it can kind of help them learn to tackle. Because let's face it, guys, these obstacles are going to be present throughout the rest of your life. The healing process, as I'm personally finding out myself, the healing process is a lifelong process, okay? Let's see, Jean says it's been 1.5 years since my amputation. I still go to the bathroom that same way. No OT or PT has helped me move past that. COVID made the situation worse this year. So Jean, we're gonna talk a little bit about this in a minute on what's next. What's next? Harabump says, walk, walk, and walk, yes. Jody says, I'm moving across the country and I was scared to get up in the big U-Haul truck. So I went to practice yesterday and I got up and down with no problem. Jody, that is a perfect example of what I'm trying to bring across today. You know, instead of saying, oh dear heavens, how am I going to move across the country? It's saying, okay, the first step is learning how to get into that U-Haul truck. So let's just focus on that one step. Beautifully done, Jody. So Melanie says, as a PT, getting people comfortable with falling and getting back up without injury. And Melanie, I tell you what, you hit the nail on the head with that one, because whenever I am working with my patients and I say, well, why don't you try going to the grocery store? You have your husband standing next to you. Just get from the handicap parking spot to the entrance of the store. And inevitably, it's a fear of falling. So it's saying, okay, let's address that fear. Let's practice that one component that is holding you back so that, you know, in the worst case scenario, if you lose your balance, you know how to get yourself back up safely. Okay, excellent point. Tina says some good exercises, proprioception work with lacrosse ball under prosthetic sneaker, partial weight bearing, really helped me to learn where my leg and foot was in space without watching my feet. Look at Tina, she's using proprioception. I like that. Destiny says being able to walk with my daughter into preschool, depending on COVID, without a cane. And Destiny, I drop off 4 kids every day at their school, and it's a minefield trying to get through that parking lot and having to go up and down curves, uneven parking lot, not to mention kids with their backpacks swinging around. You got your groups of moms talking here that you have to go in and out of. It's an obstacle course. It really is an obstacle course. Linda says, putting weight on my prosthetic and lifting my opposite leg for 10 seconds and now trying not to hold on. Very good. All right, let me go back here. All right, guys. So I just want to kind of wrap things up. Now, for some of you listening, I know I have some rock stars out there. Some of these issues that I mentioned specifically today weren't necessarily ones that you had to go through. Excuse me 1 second. I have a cranky cat. Some of you may have been the rock stars that came from the hospital and immediately started going out into the community and participating in the community. But at some point, each one of you has or will run into some sort of roadblock. Whether it's an activity that you used to do before amputation that now you have to try for the first time using a prosthetic leg, or maybe without a prosthesis. Or maybe it's taking that first trip out of town to go see those family members that you haven't seen in a really long time. At some point, there is something there that you want to be able to do. And if all I can do today is to get you to examine what that is, what is it that you want to do to improve that quality of life, then I'll have earned my supper. And I would encourage you, take that one thing and just really take a good look at it. Jody's got the perfect example of what she just said right there. You know, she's moving to a completely different state and city. And instead of looking at that task as a whole and looking at, you know, where you are in the beginning and where you need to be at the end point, look just to see what's that next step that you need to take to get there. For some of you, it's acknowledging that, yes, in order to be able to do what you want to do, you need to improve your strength and balance, and you need to finally make that appointment with the physical therapist, which, believe me, guys, I appreciate just how much guts it takes to do that, to make that commitment, not only as a time, but just that mindset of saying, I'm going to do this. Okay, so I want to hear some more thoughts on what are some of the things that you all, just pick one task, one thing that you all want to be able to do that you have not been able to do. Let's see some of the posts here about that. Will, how am I doing on time? I'm good. Okay, awesome. I see so many comments coming through here. Let's see. Jen says that Jennifer says, as a prosthetist, am I to expect a PT or OT to help with amputees to use the bathroom? Typically, I think that is taught at inpatient. I will try to assist to get therapy for amputees while I'm treating. The answer to that, Jennifer, is yes, absolutely yes, and oh my goodness, yes. In every setting, Jennifer, the physical therapist and the occupational therapist especially, we are meant to be assessing the different aspects of activities of daily living, ADLs. So like I said, I've worked in every single setting of physical therapy, and in every single setting when I'm doing that initial history and physical on my patients, I ask them that specific question. How are you getting to the bathroom? How are you getting in the shower? Do you have any difficulty with this? Because it could very well be that it's never been addressed before. They could have made it to outpatient and they're still having to use a walker to get into the bathroom when maybe they're capable of doing it without a walker or without necessarily the elevated toilet commode. So yes, Jennifer, this is definitely the time to talk to your PT and OT because they can really help your patients out in this regard. Let's see, Carol says, with car headlights, you only see 10 feet in front of you. There you go. Phyllis says, with swimming. So Phyllis, this is a great one. And also because I'm here in Florida, people want to go to the beach and they want to go to the pool. So in taking swimming, a couple of different steps you need to look at. Take a look at the prosthesis that you have on. Is it something that is allowed to get wet? So you need to determine, am I going to go swimming and get into the pool with my prosthesis or without my prosthesis? And this is something, a conversation you need to have with your prosthetist. Your assistive devices. What assistive device do you need to get yourself across a pool deck that potentially will be wet and get you safely to the edge of the pool? I know many of my patients for this stage, they like to use either a walker or crutches, depending on their level of balance, okay? Once you get to the edge of the pool, and again, this is something you might want to check out before you even try swimming. Just go take a visit to the pool and just see what the setup is. Do they have the chair that lowers into the pool that you can learn how to use with the lifeguards? Do they have a walk-in, a graded walk-in section, or do they have stairs to get into the pool with a railing? And you need to plan, okay, how am I going to get into the pool? How am I going to get out of the pool? And once I'm out of the pool, how do I get back and up into standing? So when you break it down into these tiny little steps and just take one step at a time, learn how to problem solve it, you can put it together. And again, Phyllis, it's not going to go perfectly the first time around. You might need to try it a couple of different times. All right, guys, we've got a couple more minutes, so I want to see if I can get to any of these questions. Susan says, stand and then walk, leading to a 5K. And guys, lately I've been seeing a lot of runners in my clinic and a lot of people who like to do races, and I love this. I love this. This is like the very definition of PT goals right here, of seeing a long-term goal and breaking it down into its little steps. And I know, Susan, you have an amazing rehab team who's behind you, taking you through each one of these little steps. Carol says, getting in and out of the sand on the golf course and not falling. This is another big one, especially in Florida as well. With the golf course, as Carol knows, you have a lot of inclines and ramps as you have to go up and down the golf course. The sand, that is a tricky one. That is a tricky one. And again, this is where you play around depending on what kind of a prosthesis you're wearing and depending on your level of mobility. But practicing on a ramp, for example, going up and down a ramp, putting yourself into a sandy area, maybe even trying it out on a playground and learning how to do some sidestepping, forward and backwards walking on sand, so that eventually when you go to that golf course, you can tackle it there. Or even, Carol, just something as simple as saying, today, I'm just going to go for 10 minutes to the golf course, to that one sandy spot, and just practice walking in that one sandy area. It could be just as simple as that, guys, just taking that one small step. Trey says, Carol Baker, keep it in the fairway. Go. Let's see what else we got here. Maggie H says, I want, need, and will get back to a triathlon. Lots of individual skills, steps, and equipments needed bit by bit. And Maggie, I do want to point out, and this is something I point out to a lot of my higher end athletes, even in there, when I ask them, I tell them, think about what your life was like before amputation and when you were running and doing these triathlons. There were so many small steps that you had to take in order to be successful with this triathlon. There was so much training you had to do. Now, you're going to be taking just as many steps and just as many preparation items, but it's just going to be in a different way. But you're still going to be able to get to that goal following these things step by step. Linda says, I can now ride my horse and recently rode an adult tricycle. It was so scary at first. Ended up pedaling 3 miles. Oh my goodness. That's a long way to go, Linda. And guys, I'm excited because today you're going to have something, an organization, Sportable Organization. And they are one of these amazing opportunities where you can get to try some of these new skills that maybe some of you have been a little hesitant to do. So if there's anything today I can recommend to you to do is rip off that Band-Aid and go see what you can do for that new skill. All right, it's been Denise says it's been 2 years, had lots of lower back pain and hip pain on the amputee side, getting pain under control with a chiropractor and home exercises. And Denise, if I can recommend to you as well, along with the chiropractor and home exercises, go see a physical therapist. The nice thing is even though there's not a whole lot of amputee PTs out there, there's a ton of physical therapists who specialize in back pain, and they can be such a valuable tool for you. So maybe that's just that extra step, just to get evaluated by that back pain specialist physical therapist who can maybe bring a different piece into that puzzle for you. All right, guys, how are we doing, Will? We're good. I got to give a shout out to the tech team behind the scenes, man. This is like the Wizard of Oz behind there. They are running this technology so smoothly. And any of you guys who know me personally know that technology is not my strong point. So the fact that this has gone so smoothly is a direct credit to the team. We've got Holly, Tracy, and Will behind the scenes. And I just want to wrap up by saying thank you so much to the Mission Gate team for bringing me on board today again. It has been an honor to be a part of this team and to speak at this conference. To those of you attending, as I say on my show, thank you so much for letting me be a part of your lives this morning. And hopefully I will be seeing some of you again in the breakout sessions this afternoon. Highly, highly encourage you, whether you're a clinician, a caregiver, an amputee, join these breakout sessions. There's so much that can be, I think, accidentally learned when you talk just to a new group of people. All right, guys, I think with that, I am going to go ahead and sign off, and I'm going to actually be an audience member, and I can't wait to see all these amazing videos that this team has put together. And as a small plug, hopefully you guys can join me this evening, Cosi Talks on Facebook, and my website is super easy, www.cositalks.com. I know, really original, right, guys? All right, guys, enjoy your day, and really just take that one thing, grab the bull by the horns, take that one thing that you want to be able to do, and start breaking it down and making it happen for yourself. All right, guys, have a wonderful rest of your day with this amazing conference, and we'll see you later. God bless.